High blood pressure or hypertension is commonly caused by PHSY-iological and dietary factors. These are always our first line of defense and attack when dealing with a regularly high reading. When people ask what should my blood pressure be, it's usually because they are aware that it has been relatively high and some form of change is needed to improve it. First-line defense techniques such as diet and exercise improvements are always helpful, but if we want to have a complete picture and make comprehensive improvement, it pays to look in all directions. During tough economic periods such as the recent recession, people may discover raised blood pressure levels which have been partly caused by financial stresses. During such times, people often resort to unhealthy habits such as increased smoking, unhealthy and drinking. Of course, yet unhealthy and unhelpful patterns of thought will play a significant part in this too. Where jobs are more stressful and as the worry of unemployment looms, raised blood pressure can occur. The reason for this seems clear enough: worry causes stress, and this is compounded by bad habits. Let's not get hung up on this stuff though. We can apply this knowledge to turn the problem around. A study of psychology and hypertension carried out by academics at the University of Padua, Italy, states that anger, hostility, anxiety, depression, and defensiveness have been often associated with the development of hypertension. The academics continue, 4 psychological aspects have been associated in patients with chronic hypertension. One is defensiveness, that is the unconscious effort to protect the self from anxiety either through diversionary and intimidation tactics or by distortion of reality. It is therefore characterized by orientation away from threatening information, denial or minimization of distress and negative emotions. Professor Andrea Semplichini, Dr. Anna Rialdi, University of Padua Medical School, 2009. According to these academics, high blood pressure is partly affected by our thought processes. What does this mean for people with high blood pressure? It is all well and good solving our practical health problems, the ones we can see such as diet and exercise, but how can we deal with modes of thinking which cause high blood pressure? Well, if work fears are a cause, we can work to reduce or eliminate them. Here it would be useful to do a kind of risk assessment of the likely impact of losing a job and try to plan for such circumstances. Although this isn't something we want to face often, planning is a form of action, and planning against such risks is likely to lessen our fears. So if fear and worry are a cause for our hypertension, we can make an impact by dealing with our thinking. Reducing fears by analysis can be a very cathartic process, and here there is a direct health benefit to boot. Looking at defensiveness, protecting the self from stress by burying our heads in the sand or by running away, most of us would admit these are unhealthy ways to deal with life's problems. Defensiveness, when it is just about denial or running away from our problems, is actually a self-deception that can add another stress burden to our daily lives. The best way for us to deal with a stress factor as with a dietary factor in high blood pressure is to recognize the problem and do something about it. If there is a cause for stress in your life, now is the time to see that defensive behavior is harming you rather than helping you. As with diet, salt intake and exercise, you can do something about its psychological factors. It starts with acknowledgement and gets easier with action. There is a dynamic relationship between our thinking and our bodies, especially our blood pressure.